Good morning, distinguished guests, ladies and gentlemen. My name is Nadine Sofia Fadil. I'm from G4H. Today, I would like to share with you my view on the topic, what is service? For my presentation today, I will touch on the definition of service in general and what I intend to focus on with regards to service. I will then highlight my main points of my presentation before closing. So, what is service? This question is far too broad and wide-ranging. When you merely search the meaning of service on the internet, you are met with an extensive definition of the word. My understanding of service, if I can put it simply, is an act of helpful activity. For example, when you arrive at the school, there is security personnel that will assist you with your registration. Then, when you enter the main building, we have information counter that can guide you further. Medical services. My presentation will be focusing on services involving the medical profession. I have always considered the medical profession as one of the most honorable occupations, together with teaching. Medical services can be defined as a system that provides something that the public needs, organized by the government or a private company. It is also the performance of any helpful duties, professional activity, or work for another. During the COVID-19 pandemic that shook the whole world in 2020 until 2023, countries worldwide experienced challenges and shortfall in the healthcare industry. It was during this trying time that the whole world started to provide extra attention to the medical profession. What inspires me the most was how the people in the medical professions were always putting the priorities of others first in undertaking their responsibilities. Ladies and gentlemen, it is undeniable that COVID-19 pandemic shook the whole world by surprise. Majority of countries in the world were not well prepared to contain the deadly virus that was contagious and spreads quickly. The challenges faced by hospitals were similarly, namely infection prevention and lack of budget. There was also mental issue among healthcare workers who were facing tiredness and mental distress due to the rapid speed that they needed to work whilst battling the horrors of the pandemic. Doctors and nurses were put under extreme work burden during the COVID-19 pandemic that resulted to depression, burnout, and anxiety. The long working hours and the fear of becoming infected and exposing their family members to the lethal infection have contributed to the declining of the quality of life of healthcare workers. The continuous pressure had not only affected their ability to perform their duties effectively, but had also affected the quality of their personal life. These challenges had increased the incredible pressures that the healthcare workers were under while serving others and exposing their lives to the infectious disease. This was what happened as the pandemic has caused the highest level of exposure among healthcare workers and their families. Thousands of healthcare workers worldwide became infected by the deadly virus and lost their lives in an attempt to save the life of many infected patients. Ladies and gentlemen, the COVID-19 crisis is a brutal reminder of the importance for the world to work together in ensuring continuous development of universal public health services. This will guarantee a universal, timely, and easy access to safe, affordable, effective, and quality health care. It is also important for us to pay attention to the physical and mental well-being of the healthcare workers. A good mental health determines the capacity of an individual to perform their roles, including their ability to work. The healthcare workers play a vital role in the health systems that can respond efficiently to disasters caused by natural or artificial hazards. However, the World Health Organization, or WHO, estimates a projected shortfall of 10 million health workers by 2030. mostly in low and lower middle income countries. Despite the alarming findings, I am not inclined towards joining the medical professions. As much as I respect the profession, my passion at the moment is art. I aspire to become an artist when I grow up. Nevertheless, I believe it is not an overstatement, and everybody here agrees with me, that people serving in the medical professions are the real heroes during the pandemic. Thank you.